the eye doctor? Chances are you have, and chances are you've played the game. But which is better, 1 or 2, 3 or 4? So sometimes the doctor does that, and sometimes a technician like myself does that. In most ophthalmology clinics, that's what happens. You see me first. Many eye conditions and diseases can be detected by simply having your eyes dilated. Some conditions are cataracts, glaucoma, diabetic retinopathy, age-related macular degeneration. These conditions can cause significant visual loss if left untreated. So, do you have about an hour or so to give to your eye health? Some points we'll cover. We're going to talk about what do I do as a technician. We're going to talk about the diseases, the data behind the diseases, the treatment, and also what they are. Lastly, and we're going to talk about what you can do to protect yourself. So what do I do? You see me first. I gather history, family history, health history, family eye condition history, and I ask about your current vision, if there are any concerns with it. I also do the important checks. I check your vision, far away, up close. I also do the confrontation visual field check, which is your peripheral vision. I also perform the necessary tests prior to you seeing a doctor. So the refraction, the gain. Then I also check your intraocular pressure, not the puff of air, but very similar. I also dilate the eyes. This widens the pupil so that the doctor can look to the back of the eye to catch any conditions that you may have. So what are these conditions? They can be found after you're dilated. So data from the National Eye Institute based on a 2010 census shown here. So based on a population of over 40, diabetic retinopathy affects 7.6 billion people. Cataracts affect 24 billion people. Glaucoma affects 2.7 billion people. And also diabetic retinopathy, age-related macular degeneration, over a population of 50, affects 2 billion people. So what are these conditions? These descriptions are from geteyesmart.org. Cataracts are a clouding of your natural lens. The result is decreased vision and glare. This is treatable. Glaucoma is a disease that causes irreversible nerve damage and eventually peripheral vision loss. Treatable but not curable. Diabetic retinopathy is common among diabetic patients. It's caused by changes in the retinal blood vessels in the back of the eye, and this is the leading cause of blindness in adults in the US. Age-related macular degeneration is a disease that leads to the deterioration of the macula, which is responsible for your central vision. This deterioration can cause new unhealthy blood vessel growth. This is treatable, but not curable. So how are these treated? Cataracts is very common. Everyone has them. Cataract surgery is what you can do to treat it. The cataract is removed, and a new intraocular lens that's carefully selected by the doctor is placed in its place. And cataracts do not grow back. Next is glaucoma. Initial treatment is drops. If the drops don't work, then the doctor proceeds to a laser surgery to open up the drainage tubes to lower the eye pressure. If that doesn't work, then a more invasive glaucoma surgery is done to lower the pressure. Diabetic retinopathy can be treated mostly by seeing an endocrinologist and controlling blood sugars. If that doesn't help and you're still having eye issues, the doctor will recommend that you see a retina specialist. At that point, the retina specialist will recommend treatments, possibly injections into the eyes. Once the swelling has gone away, then the doctor moves on to laser treatment of the eye. And that clots the blood vessels and allows the tissue to heal. Age-related macular degeneration can be treated, but is again not curable. The first treatment is vitamins. If And if the macular degeneration changes and grows new blood vessels, then they will get treated with an anti-VEGF injection into the eye. And that helps the leaking of the blood vessels to stop and help the swelling to go away. So what can you do? These are tips from the CDC, so you can know your family history. Are there any eye conditions? And eat right and maintain a healthy weight. Wear protective eyewear. Anytime you're doing something dangerous, protect your eyes. Also, wearing sunglasses reduces the risk, reduces UVA and UVB to the lens. And quit or never start smoking. Lastly, have a dilated eye exam every 1 to 3 years. So, in review, technician is normally the first person you meet. That's me. Cataracts, glaucoma, diabetic retinopathy, and age-related macular degeneration are all vision-threatening conditions. Some are treatable, but not curable, and you can do many things to help protect your eyes. The most important is a dilated eye exam every 1 to 3 years.